Hello, I am Rebecca, a speech and language therapist working in an integrated health and social care multidisciplinary community team. This project is part of my Further Advancing Personal Skills and Practice in the Workplace module as part of the MSc Advanced Practice Speech and Language Therapy in Cardiff Metropolitan University. This project is an evaluation of a relatively new post, a Band 4 Speech and Language Therapy and Dietetic Assistant Practitioner post. It is an unregistered role, however, they have more autonomy and more in-depth knowledge than the traditional Band 3 assistant post. The role is set in the nursing homes and residential homes, which will be referred to as care homes. It encompasses training of care home staff, as well as assessing people with eating, drinking, swallowing and nutritional needs, as deemed appropriate by registered staff. It is suggested that 3/4 of people in care homes have eating, drinking and swallowing difficulties, and half of those are malnourished. This role is supported by current Welsh Government policies in terms of bringing health and social care together, as well as a focus on people remaining well in their home for as long as possible and offering a preventative approach with early intervention. There is a drive to redesign current roles to include the development of joint multidisciplinary roles, as well as looking at current services and finding new ways to deliver them. With the current financial crisis of the NHS, this is more important than ever. In terms of expanding assistant roles, there is a suggestion of the benefits being improved patient care, increasing staff capacity and increased job satisfaction for the assistant. Challenges include governance, specifically competence and scope of practice. Registered staff have been noted to be reluctant to change what they are currently doing and fear for their own job security with assistants taking on more roles. Suggestions to make the role a success highlight ensuring governance is in place, in particular how competence will be measured, the importance of regular supervision, and having a clear career progression set out. A focus group was set up with registered speech and language therapists and dietetic staff to explore their views on the introduction of the assistant practitioner role and the perceived benefits and challenges to the service and patients. To enable the group to remain a focus group, I invited the speech and language therapy and dietetic assistant to join to ensure there were 6 people present. My plan was to then carry out interviews with the care home managers to explore their views. However, working to a strict time frame and due to their pressures and demands, we were unable to make this work. So I carried out a semi-structured interview with the assistant practitioner. The focus group and interview were recorded and transcribed to enable me to review the data. Braun and Clark's 6-step approach was used to theme the responses. The table shows both the benefits and challenges from both the focus group and the assistant practitioner. The benefits far outweigh the challenges. Some themes were similar, for example, developing skills of others and workforce factors. Some themes that arose that hadn't been discussed in the literature was their role in speech and language therapy and dietetic student training, as well as the impact they had had on the Band 3 roles. They felt their confidence and job satisfaction had improved working closely with the assistant practitioner. Some key quotes highlight how the assistant practitioner has enabled a preventative approach in relation to the use of supplement drinks, which also results in cost savings being made. Governance that had been put in place with all case notes by the assistant practitioner being reviewed and signed by a registered member of staff. The assistant practitioner highlighted they were cheaper than a registered member of staff. In terms of the salary, this is true. However, this role and the individual in this role has been worth their weight in gold in terms of the training they deliver and the impact they have on patients being seen and assessed for eating, drinking, swallowing and nutritional needs. In addition to the thematic analysis, I have gathered some quantitative data. In the financial year, April 23 to March 24, the assistant practitioner delivered 98 training sessions, training 825 staff, which is just phenomenal. Registered staff have not been in a position to train care home staff in recent years. The consistency of this training is supporting improved care for patients. Within this same time period, the number of patients the assistant practitioner saw for initial assessments tripled, freeing up registered staff time to see more complex patients. In this same financial year, an estimated cost saving of £7,150 was made. The difference in a Band 4 versus a Band 7 carrying out the tasks the assistant practitioner completed in terms of patients seen and training hours provided. This figure would be much higher if travel time, preparation of training sessions and resources was also included. My reflection on this project is that it's just a starting point in the evaluation of this role and how we can wider use this role. The data gathered can be used to support a business case for more assistant practitioner roles, and there is scope for them to work with people in their own homes and the training of registered carers who provide their care. My research skills have further developed in terms of carrying out a focus group and analysing data. Reviewing the Welsh Government documents just helps further widen my knowledge in terms of what we should be aiming for, as well as thinking about other areas of the service and how I can demonstrate that we are meeting what these policies and drivers outline. I would like to interview more staff, for example care home managers, care home staff, patients if possible, and their families, to gather further insights and different perspectives into the benefits and challenges of this role. While carrying out this project, the Cabinet Secretary for Health and Social Care reinforced a shift in community services to focus on prevention and for services to show that they are delivering value for money along with good patient outcomes. In my opinion, this project highlights how we are doing this, and the data supports that.